Welcome to Unlocking Potential, a Red Door Pediatric Therapy podcast. We're your hosts, Heather and Kelli.
With master's degrees in speech-language pathology and decades of pediatric experience, we've been the co-owners of Red Door Pediatric Therapy since 2006.
On this podcast, we share stories and strategies that can unlock the potential of functional, behavioral, emotional, and social development in children today.
Today's guests are Seriann Swiontek and Hannah Scott, physical therapists at Red Door Pediatric Therapy. Welcome to today's episode. We are talking about pelvic floor dysfunction and incontinence, and today we have Seriann and Hannah with us. Why don't you kick it off and tell us just a little bit about yourself, Siri?
Yeah, I'm Seriann Swiontek. I'm a physical therapist here at Red Door. I've been here for just about 2 years now, and I specialize in pelvic floor or pediatric incontinence and pelvic floor dysfunction. I'm originally from Wahpeton, North Dakota, and I went to school here and stayed here.
Awesome. Wonderful.
And I'm Hannah Scott. I've been with Red Door since January of this year, and I specialize in neuromotor disorders and also in pelvic floor dysfunction. And I'm originally from La Crosse, Wisconsin, and just moved up from North Carolina in December.
Thanks for joining us. I think this can be kind of a tricky topic to talk about, so let's just dive right in. What is pelvic floor dysfunction or incontinence?
Yeah, pelvic floor dysfunction is simply the muscles of the pelvic floor aren't able to work together to fully get out your poop or pee. Incontinence is you're leaking throughout the day, or you're doing one full bladder emptying where you have an entire amount of urine that just goes on the floor or under the clothes. The clothes are soaked. It can be constipation, where many of our kids come in and that's their primary concern we're seeing, is that they're so backed up that then it hurts to poop, and we don't want to poop because I don't want to do if it hurts either.
Right.
You don't want to do anything that hurts.
Everybody's looking to avoid it.
Yeah. And then another one is bedwetting. Many people don't realize it. They just be like, oh, why are you still wetting the bed? And many times I think we use the word accident, and we don't like the word accident because accident's something you did and you don't want to do it again. Well, the kid can't control it a lot of times. So that bedwetting is a huge concern. And we need to know too that if it's happening past that typical age of 6 and that bladder is developed, then there's a concern there because kids can't go to sleepovers.
Sure. Right. So it's a topic that nobody actually really likes to talk about, but if we just approach it candidly, we're all going to get the information that we need and know if it's something that we need to help our kids with. What, Hannah, are some symptoms to look at?
So a lot of times the kiddos will have symptoms of bedwetting. I think that's very common. That can happen at night, or we can also have incontinent episodes during the day. It does not have to be either or. Some kids might be wetting during the day and at night. Another thing, like Sari was saying, is constipation. This one's a little sneakier. So I think this one is worth talking a little bit more about because it's often the culprit kind of behind the scenes. And if we are really backed up and constipated, kind of having that full belly look or that hard belly look, that might be something that a parent can pick up on, but might not think that it's constipation. And it can cause the full bowel to push on the bladder and cause those incontinent episodes. So they might not know that constipation is also an issue. They might just see the bedwetting and just think that their symptom is bedwetting. Other things that we can see is that kiddos might be able to hold it, but they might be going to the bathroom very frequently throughout the day. They might go to the bathroom and then a little bit later feel like they have to go again because they weren't fully emptying their bladder. And like Sari said, if we're constipated and backed up, it might be more painful to poop. We also might see that they're straining or kind of having to push to start a bowel movement. So those are some other things that we can see along with constipation.
It's interesting because when your kids are little and they're potty training, you're really tuned in to what they're doing in the bathroom. And as your kids get older and you assume that there's some level of privacy, even if it's past 4 years old, you don't know unless you ask them what happened in the bathroom. And then especially when they go to school, they have a whole day that then you have to be like, well, did you pee? Did you poop? How did it go? What did it? And they're like, oh, this is mortifying. And so how do you encourage parents to be able to have kind of easier or more upfront conversations with their kids when they might know that there's a struggle?
That's tricky. And I think in an evaluation and even in our treatment sessions, that is a hard topic because we are relying on the child to be an accurate reporter. That's hard to do, and we might have to pull the parent in to at least check on right after they go to the bathroom, even if they're not in the bathroom with their child. But for the time during our treatment sessions, even if that's something that's a little bit uncomfortable for the child, I think getting that accurate report of what happened and how much you went and what you drank before you went to the bathroom is really important to know in order to progress in your treatment sessions. A place where we can help our parents out is by providing what we call a bladder log or a bowel log. So we'll give them a chart that they can work on filling out over the week before they come back to therapy. And it'll show how often they went to the bathroom. There's different types of stool or poop. So we want to know what your poop looks like and if it's runny or if it's hard or if it looks like rabbit pellets. That's all important to us to know what the health of your bowel is. And likewise, it's important for us to know how much you are voiding or going pee. We want to know how much you're taking in and then how much you're putting out as well.
So at some point there has to be a conversation like, this might be embarrassing for you, but this isn't embarrassing for me. We're just trying to help you feel better, and we're just going to go through the motions to get you there. And it involves reporting on something that might not feel like, oh, I don't want to talk about this with my mom or with my dad, but kind of getting past that step to be able to move, hopefully, in a short amount of time to a much more successful step.
Mm-hmm.
Yeah, and I think if it's impacting the kid that much, a lot of times you remember those things that are uncomfortable situations in your life. So if it's hurting them to go poop, they probably do remember that.
Sure.
And kids are also curious, so they actually look at their poop, and when you show them a thing, is it rabbit turds or is it like slime coming out of there?
They're like,
And
you know what, it's this.
Yes.
You can make poop fun.
Yes.
You can.
Yes, and they do like that. I mean, they'll tell you, and at first it may be uncomfortable. That's why we use different strategies. Like we ease into the conversation and we bring out toys first versus just going right away and be like, you don't know who I am and I'm going to do this.
Right.
So our main number one job is to try and make sure the kid's comfortable and the parent before we start.
So if a parent had a concern about this and they wanted to get started, what would an initial assessment or an initial evaluation look like?
Yeah, our evaluations look a little bit different than what you might expect or be used to at Red Door. And so we want to make sure that parents are ready for that and know what to expect. Our evaluations are 2 hours long, and we start just by talking and having a conversation with you and your child about what your concerns are and what difficulties they're having. So we might talk about when you're having those incontinent episodes, what you've already tried, maybe a bed alarm, maybe reminders from your parent. We'll ask about what your toileting habits are, if you use a squatty potty or if you sit on a smaller toilet or a regular adult-sized toilet. We'll also ask about your diet because we know that food and especially different liquids and fibers are important to make sure that our bladder and our bowel are healthy. And then we're also going to make sure that we talk about their sensation. So if your kiddo can tell if they have gone to the bathroom and can tell if they're soiled or wet. From there, our evaluation gets a little bit more technical, and we'll use some sensors and some equipment to really see what those muscles are doing when we are initiating a void or initiating going to the bathroom. And we'll also look at their muscles of their pelvis and legs to see how tight they are or how those muscles can affect our toileting as well.
So since this is kind of in a sensitive part of the body, what kind of strategies do you do in therapy to help some of that bladder emptying or even the bowel emptying?
Yeah, that's a great question. A lot of times we'll look at their position on the toilet, we'll use different breathing techniques. A lot of people don't realize that when you breathe in, your pelvic floor is actually the bottom and helps that diaphragm for breathing in and breathing out. And so we look at the breathing techniques. We look at your core muscles, so your tummy strength. When people are sitting on the toilet, you can sit hunched over, or if you're sitting up nice and tall, it provides a better exit for either your poop or pee to come out.
Sure.
So we look at that. We can look at what those muscles are doing to coordinate with each other, like we said, those sensors Hannah talked about. And then we overall just kind of teach them their anatomy, what is down there. We do teach them, like, this is your bladder is a muscle. We teach them, this is your poop comes out of your rectum. It's just teaching them the anatomy, so then they're familiar with what they're trying to feel and what they're trying to accomplish at therapy.
So what are some of the reasons that might put a kid in this position?
There's several reasons. One of the big ones is constipation. Our first thing we always do is rule out constipation, because if a kid is constipated, it actually puts a lot of pressure on that bladder. And usually you'll see that first kid coming in with they're leaking throughout the day or they're bedwetting. Well, then we always go back to, are they constipated? And how are those bowel movements coming out? We look at incontinence, so daytime or bedtime wetting. It can be leaking. It can be that full bladder amount. Maybe it's random. They don't know. Maybe they're jumping and that whole bladder comes out. And they can't figure out why they can't play with their friends because they're wetting their pants, and it's not fun.
It is, and I think it's often parents are not connecting that it is actually a constipation issue because they just don't think about it. They're two different systems of eliminating. So, yeah, that's interesting. I'm sure it's not something people think about normally as being connected.
How do parents know if it's not sort of a phase after potty training, or how do they kind of know that now's the time to seek services?
I think a big part of that is how important it is to the family and to the child. So again, we want to make sure that the child is aware that they are wet and that they have motivation to do the work to get better. So if this is something that, like Sari said, is stopping them from going to sleepovers or stopping them from fully participating on the playground at school with their friends, that's going to be super motivating for them to come in and get treatment for this. And another piece of that is to let parents know the time frame. This isn't something like other therapies that might be an ongoing basis. A lot of times these plans of care can be a little bit shorter. It goes a little bit faster in how we strengthen because it is so specific. We have the technology to give that real-time feedback to the child as well. And so the learning curve can be a little bit faster. And if it's something that's really limiting to their participation with their friends, we want them to know that getting treatment now can be a little bit faster for them.
Can you talk a little bit about the technology component and the feedback?
Yeah, so we call it a surface EMG, which just like it sounds on the surface of your skin, nothing goes inside. It's just a little sensor, it's a little sticker, and it just tells us what the muscles are doing down there by your pelvic floor. So we don't have to touch or do anything down there, we can just put the stickers on and parents put them on for us. So the child's more comfortable, because that's our number one thing is we want the child to be comfortable in the setting and coming to talk to us about these, because it's weird for all of us. It's private for all of us. And
Do the stickers hurt?
No, the stickers don't hurt. I mean, when you take them off, there's a little bit of stickiness, but so far no one has complained. So they just are able to tell us what's going on. And when we hook up the sensors, there's like a little tail that comes out of your pants, and we just pull our pants right back up so we don't see anything. Mm-hmm. And they call it like the elephant tail. They have a tail coming out. And we hook that up to our computer, and it can then read our muscles. And then it's almost like a video game for some kids, because there's a goal on there. So when they contract and do that Kegel, they'll see the bar rise up, and then there's a goal. And then we even have where you can do a spaceship that launches off, or a butterfly, and different cool animations like that. So kids find it fun. I mean, just like kids love video games, this is like a video game. I had a kid the other day that it was a challenge to him to make sure he could hit his goal, and then he could go down to his resting tone to relax that pelvic floor muscle.
That's a great point, because my next question was going to be, when you have a pediatric practice and you see kids, then one of the main priorities for every service we offer is how to make it fun, how to make it engaging, how to make it so that it's something that they want to come to. And this can be kind of embarrassing for kids, especially older kids. And so you kind of touched on that a little bit with the fact that it's certainly isn't invasive. It's not, that part's, not embarrassing, and there's a video game component. But how else do you kind of tackle the fact that it's not necessarily a topic that kids might want to talk to you at length about?
Another thing that we can do is use resources of books or illustrations. Like Sarah had said before, we want to make sure that we're talking about the anatomy and talking realistically to them about what their muscles do, what their bladder does. But there's certainly resources we can use that touch on how it affects them socially as well. So we can talk about how everybody has to go to the bathroom. We can talk about how the toilet is a safe function. We are not going to disappear when we flush the toilet. We can talk about how we can make our poop feel better when it comes out, because sometimes these children are struggling with pain because they are so constipated and because their poop is so hard. So there's lots of resources we can use for that. But another thing in the sessions and in the treatment is that we are working on the muscles of our pelvic floor, but there's other pieces that are involved in the rehab of those muscles as well. So other fun things that we can do is blowing bubbles, or we can sing songs, we can kick a ball with our legs to strengthen our core. There's other activities that we'll need to do to support the muscles and the regions around the pelvic floor as well. And breathing is definitely a big part of that.
So it's not just all bathroom all the time.
No.
So what other professionals are usually involved?
Yeah, that's a good question. For the most part, an occupational therapist or physical therapist is generally who you will see. Both of us hold doctor and master's degrees, and then we've all gone to a continuing education course that's 22 hours long, and that's where you learn how to evaluate, how the muscles work together, how the bladder functions, and how that rectum plays off of it in the colon. We do training with the technology we talked about, that surface EMG, and how to use that, how to hook it up, how to troubleshoot it, all the fun stuff coming along with that. And other techniques that's nice is, as a PT, you specialize in muscles. As an OT, they specialize more in the habit training and, like we said, the potty training. So working together, we can really help these kids, because it's really both of us, the habit training, because some kids don't want to stop playing with their friends. They want to keep playing, so that's part of the aspect. Or they don't like to get up in the middle of the night if they have to go to the bathroom because they just don't want to get out of bed. So working on the habits, working on the positioning on the toilet, and how to even wipe. Who knew wiping can cause UTIs? Many people don't know that wiping, you want to wipe from front to back, and that can prevent UTIs. UTIs is another common symptom that kids may come in with. And as a kid, that's a lot of damage that can happen to that bladder, especially if you're having them so young. So there's a lot of damage that can happen if we don't get into therapy right away.
Do you guys typically work with physicians or nutritionists, or are there other sort of outside referrals that are often part of this?
Yes, there can be, and that's what we're trying to constantly build. This is a newer kind of realm for everyone. I mean, people don't like to talk about it, and now people are talking about it because it needs to be talked about. So working with physicians on if they do need to have a full clean out, which means they'd have to go on some laxatives to clean everything out of that bowel, because we said the first thing we want to do is get rid of that constipation. Then we need a physician to prescribe those orders for us. If we want to, like you said, nutrition, because fiber is such an important part of our diet. And a lot of times that's, if we're backed up, it's probably our diet. And then water intake too. Kids don't like to drink water. They like juice. They like milk. And a lot of stuff is bladder irritants, and people don't realize that. So working with a nutrition or dietitian too as well to figure out that diet aspect, and sometimes counseling. These kids are going through, some kids will be doing this for 6 years. They might not be in school because it's embarrassing. It's hard to go to school. So trying to help them through those things as well. That's not our specialty. So making sure we make those proper referrals.
Well, thank you so much for joining us today. This is a topic that people probably don't like to talk out loud about, or don't know who to talk out loud about it with. And so we appreciate, your knowledge base, because this is new for you in terms of a new service that we're offering, and pretty new training. And so we appreciate your expertise, and thank you so much for joining us. We appreciate it.
What you guys do is very impactful and changes daily lives. So we do want to express how we appreciate you guys.
Well, thank you. Well, poop can be fun, pee can be fun, and we want everyone to know that it's okay to talk about. It's not embarrassing. It's what someone does every day.
Thank you. We're excited to help start this program for you guys, and we're excited to get out in the community and help those kids.
Thank you for listening to this episode of Unlocking Potential, a Red Door Pediatric Therapy podcast.
Please like and subscribe for more interviews and content, or connect with us online at reddoorpediatric.com.
Thanks for joining us, and remember, communication is key to unlocking your potential.